Hi, I'm Dr. Nick Camboris, Senior Clinician here at the Chiropractic Spine Center. And today I want to bring up two topics. I'd like to talk about back to school in children's spinal health and why pediatrics should see a chiropractor. Stay tuned and find out why. It's just about that time of year again, and our children are going back to school. Common things that they do are carry backpacks, do a lot of reading, and use their electronics. All of this places a lot of stress on the spine. A great way to carry a backpack is to use both straps over the back as opposed to one over the shoulder. That'll cause a lot of compensation in the spine and can cause increased strength on one side of the body compared to the other, leading to spinal problems. It's not normal for a child to complain about pain. However, it is common. And the reason that this happens is improper posture or stress on the spine because of bad ergonomics or consistently poor posture puts stress on the joints, and over time that will eventually put stress on the nerve, and then it creates pain and muscle spasm. It's similar to having a child who has a cavity, for example. The cavity doesn't just appear. Deterioration of the enamel happens first, and that's because preventative maintenance didn't happen in the first place. So good flossing and brushing and frequency probably didn't occur, and then you can aggravate it with sugary foods. Similarly with the spine, it doesn't happen overnight. It takes time, it takes stress, and preventative maintenance such as postural exercises didn't happen. Eventually pain occurs, and that's stress on the nerve. So if you have a child who has a cavity that is now irritating the nerve root of the tooth, obviously it's something to take care of. Why wouldn't it be taken care of before that? With the spine, why would you wait until there's stress on a nerve? Take care of it before it gets to that point, which leads me into describing about chiropractic pediatric. Chiropractic pediatric treatments are best done when it's treated preventatively. Treating the patient before the problem occurs is the best way. And ultimately, what a chiropractor is trying to do is find a spinal subluxation. It takes over a decade to develop the skill. Finding that spinal subluxation before it becomes a problem is the best way to take care of it. And if your child is complaining about pain, the problem has been there for a long time. It's not time for the orthopedist, it's not a fracture, it's probably not even a scoliosis. However, this can be treated with a chiropractor by providing spinal manipulation over the subluxation and then helping that child to learn the most appropriate exercises and good ergonomics to prevent it from getting that way in the first place. That's the best reason to take your child to a chiropractor. So I do recommend practicing good ergonomics with your child, explaining good posture behind a desk, and giving them great exercises to help to compensate for that added stress sitting behind a desk or carrying their books and their backpacks. I look forward to seeing you visit your chiropractor today.